I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro, and in this video I'm going to do something different. I'm actually going to treat a live patient. Now don't get me wrong, I would never be treating a dead patient. What I mean by live patient is that it's an actual patient. It's not an actor or one of my colleagues. All I know about this patient is his name and what he's coming in for, hip pain, but I've never seen him before. I want to make a video showing you how I use the McKenzie Method to evaluate a patient and then to guide my exercise prescription and my treatment progressions. Dr. Sam Schroetke here with Physical Therapy and Hand Clinic of Hillsboro, and I'm sitting here with Tyler, and he's seeing us for a couple of reasons, but one is hip pain. And I haven't done any of the McKenzie reductive exercises on his hip yet, so this is kind of going into it blind. I do know what his limitations are. So he was having right-sided hip pain. He plays basketball in college, and he was having right-sided hip pain. And I've looked at his hip mobility, and it is, I would say, significantly limited. So we're gonna. And how long were you having the hip pain? About
a few months.
A few months. Okay.
Yeah.
Did it come on suddenly, or was there an injury?
Yeah.
Okay. Both sides or just the right?
Mostly just the right.
Okay. So I'll show you guys what his limitations are. We'll try the most common reductive exercise, and then we'll look at those limitations again and see if it clears it up. This is his left side, the non-painful side, but it's pretty darn limited as well. So he might just have won the genetic lottery with limited joint mobility. But here we go here. So flexion first. So I hit resistance right about there. But that's okay. I can bring him to end range. I can tell he doesn't like it so much. But again, this is the unaffected side, right? Now we're going to look external rotation. So just kind of pay attention how far his foot is getting up toward his shoulder. That's actually, I don't know if you can see, that's decent. That's not bad at all. Internal rotation. So I'm going to bring his heel up toward off the same side shoulder. He doesn't like that at all. It's limited. I'd say this is moderately limited. And then we'll look at this Faber guy here. That's okay, actually. That's not so bad. Are you okay? Yeah. All right. So there's flexion. Now we're going to look at the other side. Come up. I'm hitting resistance earlier. He's wincing more. It's tighter, for sure, tighter. External rotation. Actually not bad. It's about the same as the other side. Then we're going to go internal rotation. You know, he's barely getting away from zero, right? I'd say you maybe have, I don't even think he has 5 degrees of internal rotation. So we're seeing limited and painful flexion, okay, more limited than the other side, and more uncomfortable, right? Limited and painful internal rotation. External's okay. And then we're going to go down in here to Faber. That actually might even be better than the other side. How's it feel?
Just a little bit.
And then we're going to look at hip abductor strength, because that's another limitation you have to find with a hip joint derangement. Hold that right there. Don't let me move you. Hold, 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 hold. Okay, so a little weak. There's some weakness there. Right? Did that hurt at all? All right. So we're gonna try the reductive movement real quick, and then we'll look at all these things again and see if it's any different. So Tyler's going to do repeated hip extension. You're already feeling the stretch.
Yeah.
So what you do, so remember this is his affected side, the symptomatic side. So he takes the opposite side, steps forward real far because we want to get a lot of hip extension, stress, and force in there. This opposite hand puts the heel of the palm on the PSIS, which is this little knobby bone. So just go below the low back on the buttock, upper buttock a little bit. Then he's going to lunge forward and a little overpressure with the hand, hold 1 or 2 seconds, and then back to a neutral position. And let's do like 15. Each time, try to get farther and farther and farther. There you go. It might be a little uncomfortable, but it should become easier as you do it. And definitely when you get done, those things that were limited and painful should be better. So look, he's getting that hip extensor stress through there. Push. So the line of drive is that way. He's not going down. There we go. Each time he's gone a little farther. Push, push, push. Hold 1, 2. Last one.
Yep.
Perfect. All right. Perfect. So this is the left. Remember, non-symptomatic side. I wouldn't expect any change because we didn't do anything. So there's flexion, internal rotation, still doesn't like that, but remember, this is the side we didn't do. External, and then our favorite here. Okay, so let's try the symptomatic side, which is the side he just did the repeated hip extension on in half kneeling. So we go this way. Any difference?
Not till later. It didn't hurt till later.
So we're getting it farther before he starts feeling pain. Now, internal is the real one. Any different?
No, not really.
Feels about the same?
Yeah.
Okay. So this way. So flexion's better, but internal hurts the same.
Yeah.
Hold it right there. Don't want to move you. Hold, 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 hold. Does that feel any different strength-wise?
I couldn't really tell.
Okay. I'm going to have to do one more set. So we're progressing this to a ballistic force now. So he's going to go forward and then pop it in like he's almost like he's doing a plyometric. 1, 2, 3, as far as you can. 4, okay, 5, 6, like really like sitting through 7, 8. That's right. Perfect. Now 14, 15. Got it. There we go. Clearly better.
Just tightness, not pain.
Okay, no pain, just tightness. That's great. Let's try internal rotation. Any different?
A little bit.
A little different.
Yeah.
Okay.
Still the pain, just not till later.
It's a little farther. It is pretty unlimited still. Let's try one more set. So you do ballistic for 15, and then on the last one, you're going to hold it for 20 seconds. Okay. So we're just doing force progressions to try to get greater reduction in the joint. So we've improved flexion, internal rotation a little bit. Each time farther and farther. Boom. 13, 14, now last hold. Clock. You okay? Yeah. You feel a big old hole through there?
Yeah.
Just force progression. So initially you just did just straight hip extension, then we added the ballistic force. Now we're adding a sustained force. I normally wouldn't probably progress somebody this quickly. There you go. Here we go. Hip flexion. Just tight. And we're getting, you can tell we're getting way farther, right? This might even be farther than this one now. So internal, ready? That's way better. Can you tell?
Yeah.
I don't know if you guys can see this on the video, but that's way farther. I mean, before we were here, right? It was here. Now we're going. That's way better.
It doesn't hurt until you get to where it stops. So.
Can you do one more set? So we're finding the combo of ballistic with a sustained hold at the end. He's playing a sport where he's jumping and cutting a lot, so that's a lot of force for the joint. So I think for his reductive motion, his reductive exercise, we have to mimic that as much as possible, as far as you can. Go a little far. With a little pressure. Boom. And on the 15th one, we'll hold it for 20 seconds. Oh, sorry. Got it? Does it feel like this has gotten any looser? Like as you've done this more?
Yeah.
Okay, good. That's exactly what should happen. It should be a rapid response. So true derangement, joint obstruction, limited and painful motion, and there should be a rapid improvement, especially if we're getting the right direction with the right force application. There you go. Good. And we're going to check once more. So you've done 60 reps now, basically.
Yeah.
Here we go. Look at that. What do you feel? Just tightness. Does it feel less tight or the same tight? Amount of tightness?
Same tightness.
Okay, but we're getting farther.
Yeah.
Okay, now we're going to go internal rotation. How's that feel?
Hurts right there.
Right there.
Yeah.
So again, before we were about here, that was it, and I was hitting a wall. But now I'm getting overpressure out to here, right? So that's significantly better. It's uncomfortable when we get to that end point. He's still farther on that side, so I think he's going to have to load this joint a lot to get a full reduction of motion. He's going to hold there, push, hold. I think that's clearly stronger. Would you agree?
Yeah.
Yeah. So he's got like this hip pattern, limited and painful flexion and internal rotation, and he had weaker hip abductors. We do the reductive motion. It took him 60 reps to get this much of a reduction, and it's not even fully reduced, but he's got just tight. We go hip flexion much farther, and tightness at the end. Internal rotation is significantly improved, pain at end range, and he's got stronger hip abductors now. So this would qualify as a hip derangement. So what he's probably going to have to do, 10 to 15 reps of this every 2 hours for a few days, and then he'll back off from there because I think it will be more likely to stay reduced at that point. All right. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro, and you've just seen me use the McKenzie Method to evaluate and treat one of my patients. Keep in mind, because Tyler is athletic, that's why I progressed him a little more quickly. Normally I would have probably just had him do the first exercise, the first version of it where he's just doing the repeated hip extension. But because he was responding kind of slowly, and he is an athlete, and I know he's doing a lot of weight-bearing, ballistic exercises, I knew that he wasn't fragile and that I might really have to increase the load and force in order to have an effect on his symptoms. All I showed you was how it increased his range of motion and it decreased his pain with the range of motion. Oftentimes, if somebody had pain with squatting or walking, I would have had them test those out as well. But today he wasn't having any pain with squatting and walking, so I didn't go there. The dosing for most of these exercises is to do 10 to 15 repetitions every 2 to 3 hours, or 10 to 15 repetitions 5 to 6 times daily. If you like what you've seen in this video, subscribe to our YouTube channel, click on the little bell. That way you're going to be notified every time I upload a new video showing you how to do one of these powerful exercises for getting rid of your pain. Like the video, share the video with your friends, and leave comments below. Let us know what you thought of the video. Let us know if you tried the exercise and how it worked for you. And let us know if you tried the exercise and it didn't work for you and made you worse. Because in that case, I can suggest a modification to the exercise, which might make it more beneficial to you, or I can steer you toward another exercise that might be more appropriate for you.